Emergency service.
My roommate, his nose won't stop bleeding. We were just messing around and it's been almost 3 hours.
3 hours? Is he conscious?
Yeah, but he's really pale now. Like, scary pale. We tried everything. Ice, pressure, pinching his nose. Nothing works.
How did this start?
We were wrestling, just playing around. I accidentally hit his nose. I didn't think it was that bad, but the bleeding won't stop and there's blood all over the dorm room.
Okay, what's your location?
Warren Towers, Boston University. Room 812, 8th floor.
Paramedics are on their way to Warren Towers. They'll be there in 8 minutes. Keep him sitting up, leaning forward. Don't let him lie down. Can you meet them at the building entrance?
Yes, we'll bring him down.
October 22nd, 2024, Saturday night. I was on duty in the ER and it was unusually quiet. Fall had arrived in Boston. The air was cold, but the first snow hadn't yet fallen. The hospital felt still, unnervingly still. Saturday nights were usually chaos, fights, car accidents, drunk students. But that night was different. I was sitting at the nurse's station, catching up on paperwork. Earlier I'd treated a chest pain case, EKG normal, discharged. Another sprain, X-ray clean, splintered and sent home. Routine cases. At 10:47 p.m., the phone rang. It was the dispatcher line, the 911 operators. Dr. Chen, incoming ambulance, 19-year-old male, uncontrolled nosebleed. It's been going on for 3 hours. Understood, I said. How far out? 5 minutes. They're coming from Boston University, Warren Towers, 3 hours. That was a long time. But nosebleeds could be stubborn. Probably a posterior bleed, I thought. I'd pack it, cauterize, and send him home. A 15-minute case, I figured. But I was wrong. 5 minutes later, the ambulance pulled up to the bay. The doors swung open, and there he was. A young man on the stretcher, Jake, 19 years old, a college student. His face was covered in blood, his shirt soaked through. Blood was still flowing from his nose, a steady, active bleed. 3 of his friends stood beside him, pale and anxious, looking both scared and guilty. The paramedic gave a quick report. Jake Morrison, 19. Nosebleed started 3 hours ago, uncontrolled. Vitals: blood pressure 90/60, heart rate 118, oxygen 96%. Slightly tachycardic but stable. We tried anterior packing en route, didn't stop the bleeding. We took Jake into the trauma bay and hooked him up to the monitors. His blood pressure was still low, heart rate fast. He looked pale and exhausted. He tried to speak, but blood filled his mouth. He had swallowed a lot. "Jake, can you hear me?" I asked. He nodded weakly. "Good. I'm going to ask a few questions. When did this start?" Jake tried to talk, but his voice was faint. One of his friends stepped forward. "Around 8, he said. "We were in the dorms messing around, wrestling, joking. I accidentally elbowed him in the nose. It was an accident." "Okay," I said. "Did you try ice?" "Pressure." "We tried everything," another friend said. "We iced it, pinched his nose, leaned him forward. Nothing worked. 1 hour passed, then 2. He started looking really bad. I examined Jake's nose. The anterior packing was still in place. The paramedics had done it, but blood was seeping around it. This was a posterior bleed, deep in the nasal cavity. Much more serious. I turned to the nurse. "Start an IV, 18 gauge. Normal saline, 500 milliliters bolus. Send labs. CBC, coagulation panel, type and cross match. Page ENT for consult." This wasn't a simple nosebleed. 3 hours of continuous bleeding meant something bigger was wrong. I looked back at Jake. "Jake, have you had nosebleeds before?" "Frequently," he nodded. "Sometimes, when I was a kid, but not for years." "Are you on any blood thinners?" "Aspirin, ibuprofen." "No, nothing. Any surgeries recently?" "Dental work." Jake hesitated. "Yeah, last week I had my wisdom tooth pulled. It bled a lot. The dentist had trouble stopping it, and right then alarms went off in my mind. Prolonged bleeding after a dental extraction, nosebleeds as a child, now uncontrolled epistaxis. These were red flags for one thing: a bleeding disorder, a possible coagulopathy. I turned to the nurse. "Call Jake's parents." I need to speak with one of them. 5 minutes later, I was on the phone with Jake's mother. It was late. She had probably been woken up by the call. Her voice trembled with fear and confusion. "Mrs. Morrison, this is Dr. Chen. I'm Jake's doctor. He's stable right now, but we're having trouble stopping the bleeding from his nose. I need to ask you a few questions." "Yes, of course," she said quickly. "They told me on the phone, but how could it be this bad?" "Jake had a wisdom tooth extraction last week, correct?" "Yes, that's right. His wisdom tooth. It bled a lot, I remember. The dentist said it was a bit more than usual, but fine. I didn't think much of it. Did Jake have frequent nosebleeds as a child?" There was a pause. "Yes, when he was little, around 4 or 5 years old. Sometimes they'd just start out of nowhere. I took him to his pediatrician once. He said Jake had delicate blood vessels and would outgrow it. And he did. Eventually they stopped. Has Jake ever had surgery? Tonsils, appendix, anything?" Her tone shifted, as if she'd suddenly remembered something buried deep. "Tonsils, yes. When he was 7. I remember because after the surgery he kept bleeding. I thought that was normal for a few days, but it went on for 2 weeks. The doctor got worried. We brought him back to the hospital. It finally stopped after that, and I just forgot about it. That was it. Post-tonsillectomy bleeding, childhood nosebleeds, dental bleeding. It all fit together. Mrs. Morrison, is there any family history of bleeding disorders? Hemophilia, von Willebrand disease? No, she said at first. At least, not that I know of. But wait, she hesitated. My husband once mentioned his uncle. I never met him. He died young. My husband said it was some kind of bleeding problem, but I don't know the details. Hemophilia. X-linked inheritance. That meant the gene passed through mothers to their sons. If the uncle had hemophilia, Mrs. Morrison could be a carrier. And Jake could have inherited it. Mrs. Morrison, we need to run some specific tests. Jake may have a bleeding disorder. We need to confirm it to give him the right treatment. Her voice shook. A bleeding disorder? Hemophilia. But he's 19. Wouldn't we have known before now? It's possible he has a mild form, I explained. Sometimes it doesn't show until surgery or trauma. Jake's been lucky so far. Maybe he's never been injured enough to notice. But now, we need to be sure I hung up and turned back to Jake. He was still bleeding, looking paler by the minute. The lab results had just come in. Hemoglobin, 11.2. Slightly low, expected after hours of bleeding. Platelets, normal, 245,000. So it wasn't a platelet problem. That meant the issue was deeper, in the clotting factors. I checked the coagulation panel. PT, prothrombin time, normal. PTT, partial thromboplastin time, prolonged. 58 seconds. Normal is 25 to 35. A prolonged PTT meant one thing, hemophilia, a deficiency of factor 8 or 9. Order factor 8 and 9 levels, I told the nurse. Stat, and call hematology for an urgent consult. But while waiting for results, I still had to stop Jake's bleeding. It had been over 3 hours now, and he was getting weaker. The ENT surgeon arrived, Dr. Reeves, an experienced specialist. He examined Jake's nose and said, "Posterior bleed. The sphenopalatine artery is bleeding. We'll need to cauterize, but first we should slow it down. There's a suspicion of hemophilia," I told him. "PTT is prolonged. We're waiting for factor results." Dr. Reeves nodded. "Then let's place a posterior pack first. Maybe we can control it without cautery. Posterior packing is a painful procedure. A special balloon catheter is inserted deep into the nasal cavity to apply pressure from behind. We gave Jake local anesthesia, but it would still be uncomfortable. "Jake, you'll feel some pressure," I said. "Just a few seconds." Take a deep breath. Dr. Reeves inserted the catheter. Jake's eyes watered and his hands clenched, but he didn't make a sound. The balloon was inflated, filling the back of the nasal cavity. Then we waited. After 5 minutes, the bleeding slowed. After 10, it almost stopped, but not completely. There was still a slow trickle. Just then, the factor results came in. Factor 8 level, 8%. The normal range is 50 to 150%. Jake's level was very low. It was hemophilia A, not severe, but moderate. Dr. Reeves looked at me. We'll need to give him factor. If we cauterize now, he'll bleed more. Do we have it? I asked. The nurse called the pharmacy. After a moment, she turned back. Yes, recombinant factor 8. They're preparing it now. We were lucky. Factor 8 is expensive and not always available, but Massachusetts General was a large hospital and had it in stock. 15 minutes later, the medication arrived, a small vial of clear liquid. Jake weighed 75 kilograms. The dose was 50 units per kilo, 3,750 units total. Each vial contained 2,000 units, so we used 2. The medication was given slowly through his IV line. It would circulate through his blood and restore clotting. How long does it take to work? Jake asked, his voice weak but steadier. About 30 minutes, I said. In an hour we can cauterize. Jake nodded. He was tired but conscious. His friends were still waiting in the hallway, watching through the glass. Then hematology arrived. Dr. Patel, the blood specialist, reviewed the chart. Moderate hemophilia A, she said. Factor 8 level is 8%. It's not severe, but low enough to cause prolonged bleeding after trauma. Why hasn't it been diagnosed before? I asked. Probably because it's mild, Dr. Patel said. Small cuts or scrapes would stop on their own. It only shows after surgery or injury. If there's family history, we should recommend genetic counseling. Jake listened quietly. So I have hemophilia, he said. For the rest of my life? Yes, Dr. Patel said. But it's manageable. You'll take factor infusions when needed, avoid contact sports, and always tell your doctors and dentist. With proper care, you can live a completely normal life. 40 minutes later, the factor started to work. We checked the PTT again. It had dropped to 42 seconds. It was still high but clearly improving, and the bleeding had slowed down, almost stopped. Dr. Reeves was ready. Let's cauterize, he said. We'll deflate the balloon, find the vessel, and seal it. We gave Jake more local anesthesia, using a lidocaine spray to completely numb the inside of his nose. Then we prepared the nasal endoscope, a thin camera that would let us see where the bleeding was coming from. The balloon was slowly deflated, and as the pressure eased, the bleeding started again. But this time it was slow, just a steady trickle. The factor was working. Dr. Reeves inserted the endoscope and looked at the monitor. We could see the back of the nasal cavity, and on the right side, a small artery was still bleeding. The sphenopalatine artery. Got it, Dr. Reeves said. I'll cauterize with silver nitrate. He took a silver nitrate stick and guided it carefully inside. When it touched the bleeding point, there was a faint hiss, the chemical reaction sealing the vessel shut. Jake groaned. It burns, he said quietly. I know, I replied. Almost done. After 10 seconds, Dr. Reeves removed the stick. We looked again. No more bleeding. For the first time in 3.5 hours, Jake's nose was dry. We did it, Dr. Reeves said. I'll leave the packing in for 24 hours. We can take it out tomorrow. Jake exhaled deeply, finally relaxed. The endoscope was removed, the packing stayed in place, and the procedure was finished. But his treatment wasn't over. We had to keep him under observation overnight to make sure there was no rebleeding, no infection, and no further drop in hemoglobin. Jake was moved to the observation unit for monitoring. Later, I allowed his friends to come in. They looked relieved, but shaken. Tyler, the one who had accidentally hit him, came closer. Man, I'm really sorry, he said. I didn't mean, it's not your fault, Jake said. It was an accident. And honestly, maybe it's a good thing. Otherwise, I'd never have found out. It could have been worse someday. Tyler nodded, still looking guilty, and so did the others. Jake's right, I said. This accident might have saved him. Now he knows what's going on. But next time, if anything like this happens, call 911 immediately. 3 hours is too long. We didn't know, said Marcus. We thought it was just a nosebleed. Now you know, I said. We watched Jake throughout the night. His vital signs were checked every hour. There was no more bleeding. His hemoglobin stayed stable at 10.8, a little low but not enough to need a transfusion. He finally slept, completely exhausted. In the morning, Dr. Patel came back. She talked to Jake about his condition. "Factor VIII can be made synthetically," she said. "You can keep it at home and inject yourself if there's ever an emergency. But hopefully you'll never have to." "Can I still play sports?" Jake asked. "Yes," she said, "but carefully. Basketball or tennis are fine, no football, no boxing, no hockey. Anything that risks head trauma is too dangerous." Jake nodded slowly. "Understood. That day I learned something important. Sometimes the most life-changing moments hide inside the most ordinary accidents." Jake and his friends were just fooling around, pretending to wrestle. One elbow, one unlucky move, and everything changed. But that accident might have saved Jake's life, because now he knew he had hemophilia. He would be careful. He would prepare before surgeries. He would avoid head injuries. What if that night had never happened? What if someday Jake had been in a real accident, a car crash, a work injury, and no one had known he had hemophilia? Uncontrolled bleeding, brain hemorrhage, death. It was possible, very possible. I've seen many hemophilia patients in the ER. Some were lucky. They knew their condition, carried their factor with them, told us immediately, but others didn't know. And for them, the outcome was often very different. I remember one man, 35 years old. He'd been in a car accident, just a mild head injury. The CT showed a subdural hematoma, bleeding under the brain's surface. They operated, but the bleeding wouldn't stop. It went on for hours. Eventually, they discovered he had hemophilia, but it was too late. He survived, paralyzed. Jake wouldn't be that man, because now he knew. Sometimes small accidents prevent big tragedies. Sometimes a nosebleed can save a life. And sometimes, as doctors, the most important thing we can do isn't just stopping the bleeding or healing the wound. It's finding what's hidden beneath, the silent dangers no one sees. It's helping people understand their own bodies. Jake understood his now. And that knowledge would keep him alive. He would finish college, get a job, maybe get married, have kids. But through it all, he would know. He would be careful. And he would live. And Tyler, he learned something too. Yes, it was an accident. But sometimes accidents prevent worse things. Tyler had saved Jake without even realizing it. And me? I learned something as well. Never ever call anything simple. Because sometimes a simple nosebleed is the line between life and death.